Struggling with sleep? Dr. Kole is here to help. Whether you need a comprehensive sleeping coach program, suspect you have sleep apnea, or simply seek a second opinion, she's available for consultations in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 15-minute consultation today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted physician.
Hi, I'm Dr. Alison Kole, sleep medicine specialist and bona fide chronic insomniac. Welcome to the Sleep is My Waking Passion podcast. Remember, knowledge is empowerment, and if applied correctly, it can help you biohack your way to a better night of sleep, just like I did. Hello, everyone, and welcome to another episode of the Sleep is My Waking Passion podcast. You know me, I'm your host, Dr. Alison Kole, and I'm joined with Dr. Stacy Ochoa. She's an experienced sleep dentist. And the reason that I'm doing this podcast is because I want everyone listening to know there are legitimate alternatives to CPAP that are really worth considering in the right patient. I get so many questions about what an oral appliance is. The old name for it used to be a mandibular advancement device. These are really devices that are meant to kind of pull the jaw forward to increase space in the airway. And I, as an adult practicing sleep physician, it's not universal that people really adopt this type of technology. And Stacy and I met through a mutual friend, Michelle Waddell. And Michelle is in my neck of the woods. Stacy is in Montana. And, when we started chatting, I realized here's a person who really understands the space, is passionate. Stacy, you're a great speaker. I've seen videos of you. And I really wanted this to be an episode that was all about the importance of collaboration. We need to play well in the sandbox together. Even if you're a dentist and I'm the doctor, we can play well. We can.
Absolutely.
I think the theme has been growing. I've seen it more talked about in the sleep world for sure. But I almost feel like it's a little bit more of a grassroots situation as opposed to something where it's really highlighted. For example, at Sleep 2023, and I may have misspoken if I missed any of it, but I don't recall there being a large segment of lectures on oral appliances, for example. And that's one of the things I would love to see. I see that there's Transform Dental Sleep, and there's all these different, everybody has their organizations. But wouldn't it be nice if we could all just kind of come together and approach this togetherness? I mean, you created the ASAP pathway. So why don't you introduce yourself and talk a little bit about the ASAP pathway so people know? I mean, this is a real cool educational, curriculum that you put together during COVID, really.
Yeah, actually, it was kind of crazy how everything went. We're all staying home and we are like, well, we have an online platform. So at first what we thought was a horrible time to launch was actually a timely. It was a perfect time to launch. And so I practice I'm in St. Louis, Missouri.
Oh, I'm sorry.
And no, that's okay. That's okay. I'm in St. Louis, Missouri.
This is how clueless I am. I'm like, that sounds like Montana. Dummy.
Hey, we're in that flyover state, so don't forget about Missouri.
Dumb. Okay.
But I started in adult dental sleep medicine. So I've been doing doing oral appliances, advancement devices for about 20 years for adults, and then had kids and started realizing, oh my gosh, what the heck's going on with the kids? And there's not really, beyond tonsils and adenoids, or CPAP, there's really not a lot for these kiddos. And especially a CPAP on a child as a long-term solution, you see more craniofacial changes because it's restricting growth and development with wearing that nasal CPAP. So I didn't want my kids in a long-term solution with CPAP. I'm like, there has to be something else. And I have heard of dentists, not only in the adult arena, but helping develop the craniofacial complex, the palate is the floor of the nose, different things like that. How can we improve the anatomy for a child so they don't have this trajectory of health of being that adult patient? And, seeing the adult patients, we see the vaulted palates, we see the horrible malocclusions, and we're like, gosh, if somebody could have gotten to them when they were kids. So ASAP Pathway was born with Michelle Weddle, Tracy Wynn, and I just coming together as dentists saying, we've got to have a clinician-based, safe space for dentists, orthodontists, pediatric dentists to be able to come to the table and say, there's something to this. What is going on? How can we help? Where's the literature with this? How can we build the literature within our practices? So, and thank you for having me. I love your podcast. I love what you're doing. There's not enough talk with sleep. When you say it's my waking passion, my family calls me obsessive over sleep. And I love when I meet another person that just realizes, my gosh, this is such a pillar of health that's just not discussed enough. You do an amazing job on your podcast.
Oh my goodness. Thank you. I'm swooning from all the affection that I'm receiving. Especially since I screwed up, where you're from, Missouri. Okay. So I'm just going to start over because there's too much editing that needs to happen. Sorry, my dear. We'll make it brief.
It's okay.
So sorry, everyone. I'm going to start over. All right.
Take two.
Okay. Take two. Yes. Okay. So welcome to the Sleep is My Waking Passion podcast. This is take two because I screwed up take one. I admit it. I am joined with me by a very special person. This is Stacy Ochoa. She is a sleep dentist. She is boarded in sleep dentistry. She has particular expertise. And she's based in Missouri. Wink, I got that one right. And she started a program called the ASAP Pathway. And I wanted her to introduce herself and talk to you a bit about what that is. It's a very exciting educational platform. What I want to do on the show is really highlight the importance of collaboration amongst different specialists. Now, I've been talking to people who were neurology sleep specialists and pulmonary critical care sleep specialists and internal medicine sleep specialists and pediatric sleep specialists. So there's been a lot of crossover, but we haven't yet spoken to somebody who is a sleep dentist. It is a very viable option for people to see a sleep dentist and use an oral appliance, also known as a mandibular advancement device. I get a lot of questions about it. Not everybody's going to tolerate a mask strapped to their face. So if you have obstructive sleep apnea and you are looking for an alternative, someone like Stacy really has deep clinical expertise. So Stacy, thank you so much for indulging me with a take two. And welcome. Introduce yourself.
Well, thank you. Thanks for having me. And the take two just means I have more time with you, so this is fine. I've been practicing dental sleep medicine for about 20 years, which I can't believe I'm saying that out loud. When I say it, it's kind of shocking. But I started in the arena of adults with the advancement devices. And sometimes it's just a matter of stabilizing the mandible, increasing the vertical, stabilizing the mandible, keeping it from falling back. Sometimes we don't even have to advance that much, but it's finding that position that's effective. But then I had kids, and I had a lot of sleep apnea in my family, treating my father with CPAP failure. He was intolerant, and the sleep physicians are like, your turn. Your dad can't tolerate the CPAP. So it really pushed me to learn about this decades ago. And there's a whole population of people where this collaboration, Alison, needs to happen, where they cannot tolerate a CPAP. And an oral appliance is a very viable option. And finding that dentist that will communicate with you, collaborate with you, have that continuity of care is super important, so we can best help these patients. But I got into the pediatric arena because I had kids and they had sleep issues. Every single one of them. I have 5 kids, had some kind of upper airway resistance syndrome, OSA diagnosis, mouth breathing, you name it. And beyond tonsils and adenoids, I'm like, now what? I didn't have answers from the pediatricians. They didn't know what to say. And then just really collaborating with other dentists that were seeing just anecdotally, just expanding the palate, creating a better anatomy for those children. Basically what we're doing for adults, right? We're dealing with anatomy. We're either blowing air past an anatomical constriction, or we're advancing a mandible, kind of similar to CPR, to keep the tongue out of the airway, another anatomical thing we're doing. what if we can get to these kids and make some anatomical changes during growth and development to change the trajectory of their life? And met with Michelle Weddle and Tracy Nguyen, my other co-founders, and we developed ASAP Pathway, which is Airway Sleep and Pediatric Pathway. It's an online community and mentorship educational platform to provide a safe space for dentists to come and learn, and orthodontists. We have oral surgeons, pediatric dentists, periodontists. How can we change the trajectory of health for these kids? We have a very sick generation of kids, and let's get real. Within our professions, it's out of our paradigm to refer to each other. Dentists are not taught in dental school in our culture to communicate and collaborate with the medical community. Now, you guys refer really well within your community to each other, but it's out of your paradigm to refer to a dentist.
That's right. It is.
So how do we change that? Because the literature is there. The literature is there that oral appliance therapy is a viable option for CPAP intolerance, or even considered equal to CPAP for the mild to moderate patient. And the literature is there showing that craniofacial development can improve airway health in children. So it's breaking down the walls, pulling out a cup of coffee and sitting at a table with people in your community and figuring out what they do. And I think a lot of us don't know what to do with certain patients, and we could help more patients if we had more of these conversations.
Yes. And that's really, this is so exciting to me because this is a start of a collaboration. I've been collaborating for years, but I don't really, my sense, and this is from speaking to other dentists that are interested in sleep, my experience, I think a lot of my colleagues are a little bit more open to it, but it does require that extra step, right? When you think about the busy day in a clinician's office, right? We're just trying to get through notes and put in orders and make sure the patients are taken care of. We're also getting phone calls and answer this thing on the patient portal, et cetera, et cetera. And so sometimes I almost wonder if one of the barriers is it almost feels like, okay, now I have to try to contact the dentist, refer them out. Am I ever going to hear back from the dentist? There's always that worry. Are we going to get that paperwork? And what timely fashion are we going to get the paperwork? I mean, some of the dentists that I've known over the years, they were wonderful at what they did, but they were a little bit more old school. So they'd mail you a letter. But the problem is with snail mail, I'm like, I don't want to wait 2 weeks to just even receive the letter that the patient was seen, because I might be having them in my office having a discussion. And so I almost figured out what was happening before I even got that letter, as opposed to a quick fax, a little email chat. Sometimes we do that with each other. Hey, I saw your patient and thank you so much, that kind of thing. So that open line of communication, it's like a extra layer that you have to be willing to do. But when you think about, you're getting to the crux of why we love sleep so much, which is prevention. This is a pillar of health. And if we can maximize one's health, the younger they are, even better. So you have a great section on your website. You are talking all about, things that, or should I say, how kids may present with obstructive sleep apnea. So you talk about its association with things like ADHD, hyperactivity kind of behaviors. Kids that are overtired, they may come across as being inattentive. Hey, adults do the same thing, right? We're inattentive, We can't pay attention, we're all over the place, we're irritable. All those symptoms could be because they're not sleeping properly at night. And treating that may actually help them to do that. If you get a better night's sleep and you think about what obstructive sleep apnea does, and guys, if you want to learn more about sleep apnea, just check out my previous podcast with Dr. Funke, because we talk all about obstructive sleep apnea and kind of get into the weeds of adults versus kids. But, the bottom line is that if you think about what happens even in a grown person when they're constantly having these insults with their drop in their oxygen levels, and, it really negatively impacts your blood vessels. It causes a lot of inflammation. If that's happening in a kid, that's not good news.
No. And, obstructive sleep apnea it's really kind of that end stage diagnosis. Like if you have OSA as a child, wow. So the population, they're estimating anywhere from 3 to 5% have obstructive sleep apnea. It could be more than that, but that's just kind of an extrapolation of what they think the percent of the population of children. But you can even go to, let's look at just snoring. So you can have a child, and you may know this as well with having PSGs in children. I would send these kids that are so obviously sick, mouth breathing, chapped lips, allergic shiners. Parents are like, they get up all night long. These are sick kids with fragmented sleep. I send to the sleep physician and the PSG comes back normal. And I'm like, but they're sick. There's no way. Well, they don't have frank OSA, but they have some kind of sleep-related breathing disorder where they aren't breathing properly, mouth breathing, snoring. And there are neurocognitive deficits that occur not only with OSA, but even just with fragmented sleep. And that could even be from restless leg syndrome. But when you have a child that is not breathing properly, whether that's OSA or another form of sleep-related breathing problems, this is a growing child. There's a lot of literature out there just going into the neurology and how that by age 6, if a child isn't getting proper sleep by age 6, that neurocognitive deficit's kind of hardwired in for good. So we got to get to these kids early, because after 6, their brains are kind of pretty much done with their neural capacities and connections. So it's like Stephen Sheldon. He is a pediatric sleep physician out of Lurie Children's Hospital in Chicago. His statement about ADD, ADHD, the majority of ADD and ADHD, the majority is a lack of sleep, lack of proper sleep. So before we put children on medication, we really need to be asking the questions, and the pediatricians need to be saying, hey, wait a second, does your child snore, or do they breathe really heavy in their sleep? Are they getting up throughout the night? What is their sleep like? And refer them to a sleep physician. But this is where that collaboration is with the ENT, the sleep physician. Look, we've done what the literature has said is the first line treatment. We've done tonsils and adenoids. What the literature shows is that in the non-obese child, after TNA removal, tonsils and adenoids, for those that don't know what that is, but it's an issue of craniofacial development. These kids have vaulted palates, restricted arches, no room for the tongue. The tongue can't go up and forward. The tongue is falling down and back into that airway. So, and the floor of the nose is the palate. So when the palate is vaulted, you can have a decrease in nasal volume. So just even expanding that palate, for every millimeter you expand the palate, you get a 3% increase in volume in the nose. But back to what you were saying, collaboration. There is a fear, I think, an unknown of stepping out of our paradigms. We are all busy in our practices. We're all doing what we do. We're comfortable with our routine. It is hard to pause and say, is there something different outside the box that I could be doing for this patient? They're just not improving. And this is where this communication needs to happen, because you're right. There are a lot of dentists that are not taught in school how to collaborate and send that communication and communicate. I personally have a software system. The day I see the patient, I send a digital letter, a fax, basically saying what I found today, what our plan is. I send it to every physician the patient has. And a lot of sleep dentists are taught this. So it's not only finding the person that maybe they're not doing it now, but tell them what you want, what your standing orders are.
Advocate for yourself. Like if you're a sleep physician and you want this technology, and you want to have that relationship, and you test it out, and it's sort of like you taking everybody for a test drive, and then sometimes you find them real fast, like I have with John and Michelle in my neck of the woods, and sometimes it takes a little bit longer. So, but yeah, I love that. Can you? On your website, you also talk about, and I figured maybe you have some great pictures and people can refer to them, but you mention 4 types of really common issues with kids that you see that may affect their breathing? The open bite, the overjet, the underdeveloped jawbone, and the upper arch crowning. Can you maybe walk us through what you mean by that? Because those terms may seem like, I don't know what the heck that means to a regular person,
Right.
but if they're seeing their kid and they know something's funky with their sleep and they're seeing some of these things, maybe that is something they can consider, that further workup, that
Yes.
further exploration. To your point, you can still have upper airway resistance and you can still have some issues with your breathing without necessarily, quote, meeting the criteria for obstructive sleep apnea, for sure.
Yes. And I mean, I really love the parents are the advocate for their child's health. And really because you mentioned earlier, seems kind of like a grassroots movement. I mean, oral appliance therapy has been around for decades and it still feels like the collaboration isn't there. And so it's like, well, maybe if the patients, and literally in my practice, that is what is happening. The patients come to me. I have wonderful relationships with sleep physicians in town, but it's mostly the patients coming to me going, I can't wear this. Will you help me? So it's hopefully getting the parents, the patients to demand the care, and they're educated. Sometimes that's how the collaboration starts. They go to their
100%.
doctor, and they say, hey, I have a dentist that does this. Would you be willing to write a script for that? Or it's empowering the patient to be their advocate for their health, for their child's health. So back to some clinical signs that you can see. A child with chronic chapped lips could be mouth breathing. When a child is mouth breathing, they are no longer breathing through the nose. So the tongue, which is nature's natural palatal expander, the tongue drives the growth of the face and the palate. Now the tongue has to drop out of its home, which is the palate, because now the child's mouth breathing. So it can start with a nose obstruction, allergies. It could be a really bad cold or something happened and it just shot that child off the trajectory of nasal breathing. Now they're mouth breathing. Chronic chapped lips, they're waking up drinking in the morning, like they're so thirsty. That's not typical. Then you look in their mouth. If you see any crowding, you really should, in baby teeth, you should see spacing between baby teeth. So if you don't see spacing, because a lot of parents are like, my kid's teeth look gorgeous because they're perfectly lined up and butt up against each other. And I'm like, actually, they're going to need expansion. They're going to have crowding because you should have spacing between your child's baby teeth. If they open their mouth and you see a really V-shaped constricted arch, their palate is vaulted. You should have a nice broad U-shaped arch. Their front teeth should overlap naturally. If you have a big space, like kids that suck their thumb, sometimes they're sucking their thumb to prop their mouth open to breathe. And sometimes they're doing that. When they do that, not only are they creating that big anterior, what we call anterior open bites, where the front teeth are shoved apart by the thumb or the tongue from an improper swallow. It can also cause TMJ problems because they're driving the jaw back with their thumb force. So those are some things to look for. Overjet, which is how far the mandible, which is the lower arch, sits underneath the upper arch. So you see kids sometimes where the lower arch is so far back, it looks like they have a really weak chin, you might say, a real like retrognathic is what we call it. But the lower jaw is just so far back and they look what people have referred to as buck teeth. Really, a lot of times it's not the front teeth that's the problem. It's just the lower jaw is too far back. So that can impede on that airway.
And so you were also, I love what you're saying, because when you think about, and you had highlighted it before, if you can intervene on a kid who's developing, in my mind, I would think that would be a lot easier than some of the other more alternative but intrusive alternative ways to manage sleep apnea as an adult. For example, I learned about this in fellowship, and you have to be very specialized in dentistry. I think you really need to be an oral surgeon for this, but they can actually kind of break the jaw, reset it. They call it a maxillomandibular advancement surgery, MMA surgery. And that's essentially like something that in the right kid who has that overjet, you probably could take care of it as a kid, and then you don't have to break their jaw and wire it shut when they're an adult and they sip through a straw for several weeks while all of that heals.
Yes.
I mean, it can be effective in the right patient, but man, is that a big, a big
It's an
operation.
invasive procedure,
Yeah.
and it's life-changing for the adults that have it and need it. But whoa, what if we could have gotten to John when he was little Johnny and he was 5 and 6 and 7 years old, and we identified that within our medical or our dental practices and said, wait a second, we're setting this kid up for a future of potentially lifelong breathing issues. And adults with sleep apnea, they have hypertension, they have issues with ADD, they're exhausted, they're tired. When it's in the adult, I mean, it's like I said, it's end stage. We can make differences. When we get them on the CPAP or the oral appliance, we can bring down the blood pressure. We can help them for sure. But the neurocognitive deficits are kind of set in. I mean, if you can get to that child when they're young, it's life-changing. There was an interesting study by David Gazal where they studied a group of 13-year-olds. He's a pediatric sleep physician, just doing amazing research right now, even beyond PSGs, looking at biomarker testing to identify children that have airway issues. Because PSG does have its obstacles for kids and people in general. But his study was, it's a group of 13-year-olds. They don't snore anymore, because here's the other thing you'll hear. Watch, they'll grow out of it. Those lymphoid tissues can shrink. Wait till they're 13, 14, then they won't snore anymore, which sometimes happens. But here's the problem. This group of 13-year-olds no longer snore. They have the typical lymphoid tissue shrinkage. They're not snoring anymore. But the ones that did between the ages of 4 and 6, again, where that neural development is so important, that window of time is so important, they were in the bottom third of their class.
Wow.
So these are long-lasting neurocognitive locked-in deficits. And the children don't snore anymore. So they grew out of it, or did they grow into it? So there's a lot of this, they'll grow out of it, or will they grow into neurocognitive deficits for life? Will they grow into some health issues for life? So it's really being more proactive and preventive and getting to these kids early. I mean, you wouldn't look at a child who needed glasses or a hearing aid. And this is what I tell the dental community, because there are thoughts and a mindset in the orthodontic community where, well, we can just wait till they're a little older and then they won't need as many expanders. We can just wait till they're, 11, 12, 13 and then do it. But the issue is, now this child's suffering. They have fragmented sleep. Some of them are desaturating. They have neurocognitive deficits. They're being labeled. Their self-esteem is just destroyed. A lot of the kids that are seeing the principal all the time, oppositional disorder, ADD, ADHD, behavioral problems, they're not sleeping, Allison. They're exhausted. And if we have a community of healthcare professionals just watching, it would be like, okay, your child can't see. They can't see the chalkboard. They can't hear. We're not going to give them glasses yet. They're still growing. Let's just wait till they're done growing. Then they'll make one set of glasses when your head's done growing. We'll make one set of hearing aids. You're missing this whole child's growth and development and taking away such an important part of their life where they could have been sleeping better. So it's just us having conversations like this is so important, and getting more physicians and dentists talking about, and just be vulnerable. Let's all leave our egos at the door and say, I don't know what to do with this patient. Do you have anything up your sleeve that could help?
Oh, I love that. I do think that sometimes, I'm sure you see it across all professions, right? You don't really want to seem like you're the person who doesn't know everything. But at the end of the day, a lot of us don't. And you might have that little nugget of information that really takes us to the next step, or makes us think a different way, or expands our ability to treat folks. I mean, I can tell you my journey from being really busy and really in a very busy multi-specialty practice, and thinking that hey, I really know what I'm doing. I'm really good at it. I can tell you this transition to being able to have chats with you and chats with other folks that are in my field. I am definitely a better doctor. I may not be as busy as I was before, but my knowledge has continued to expand because I'm able to take the time and that commitment to go out of the way to go to various conferences and have those conversations, just exploring a new way to communicate with the public and with my colleagues too through this podcast. It's been really life-changing. So I just want to thank you so much for your time. This has been so cool. I hope you guys have learned so much about why it's important to really think about what's going on with your children. And whether or not there is something going on, especially if you're concerned about something with their breathing. Okay. So think about sleep dentistry and know that these collaborations exist, and, talk to your provider about it if you feel it's the best thing for your child. Advocate. It's okay. It is okay. It's a wrap. Season 2 is finishing off with a bang. We are going to have Stacy Ochoa be our 12th and final episode of Season 2. And don't worry, we'll be back for Season 3 come January. Hello to all my fellow sleep biohackers out there. I have a call to action for you. If you are enjoying this podcast, if you feel that you are growing, you're more knowledgeable, you're feeling empowered about your sleep, that is the purpose. So please take the time to like and review the podcast, share it amongst your friends and family. Please follow me. If you'd like to follow me on Instagram or Facebook, I am there as well. My handle on Instagram and TikTok is AskTheSleepMD. And you can also go to my website, AskTheSleepMD.com, for more information about each of these episodes. We will be sharing with you cited articles that you can actually refer to and read yourself if you like, and lots of juicy tidbits about how to sleep better. Thank you. This podcast is made possible with the exquisite talents of Mr. Joey Salvia, my producer, Mr. Adrian Pederath, my creative director, and music by Lori Kunzel of kunzelmusic.com. Disclaimer. The statements made on this podcast have not been evaluated by the U.S. Food or Drug Administration. They are not intended to diagnose, treat, cure, or prevent disease. The information provided by this podcast should not be used as individual medical advice. While I am a practicing sleep provider, I am not your sleep provider. You should always consult with your personal healthcare provider for individual recommendations and treatment.